If you pee yourself every time you laugh, cough, sneeze, run, or jump, it could be caused by pelvic core dysfunction. Stick around to learn what that means. Hey guys, Kalini here from Gymnazo, and let's talk about the pelvic core. In this video, I'm going to explain what the pelvic core is, what it does, how it functions, and how we can get rid of embarrassing, common problems like incontinence that are caused by pelvic core dysfunction. What is the pelvic core? Well, pelvic core is actually short for pelvic core neuromuscular system, or the PCNS. The PCNS is composed of several pieces. It's composed of the respiratory diaphragm, our abdominal muscles, low back and hip muscles, and the pelvic floor. So we have this one giant system, top, bottom, front, back. It's one unit. It's fascially connected. All of those pieces fascially connect to each other, which means they're proprioceptively and neuromuscularly linked to each other. So this functions as one system instead of individual components. Now, the pelvic core is responsible for a lot of our bodily functions. It's responsible for urination, defecation, sexual function, pregnancy, labor and delivery, and much, much more. There are so many different types of dysfunction, and so many of them are common dysfunctions. We've normalized some of them, but really these aren't normal. They're just very, very common. In fact, 1 in 3 women suffers from some type of pelvic core dysfunction. Pelvic core dysfunctions includes incontinence, urinary or rectal. It includes diastisis recti, which is a separation of the abdominal muscles, pelvic organ prolapse, knee pain, back pain, sciatica, and pain with sex even. There's a whole laundry list of these dysfunctions, and again, all of them are common but not normal. And our job as trainers is to help fix these dysfunctions through exercise and intentional training. Now, how do you train the pelvic core? Well, there's a lot of great ways to train the pelvic core, but again, we're going to train this as one solid unit. Now, to really start with our training, we have to get our breath work going. Breathing is typically a subconscious action that we don't even think about. When I'm having a conversation, I don't all of a sudden stop and go, oh my gosh, I need to breathe. I just breathe as I speak. Your pelvic core should function the exact same way. And really with breath work, it really helps get the whole pelvic core connected because it influences all of those components that we talked about earlier. They move and they biomechanically go through a process when we breathe. As we breathe in, our rib cage expands, our respiratory diaphragm draws down, our pelvic floor actually draws down, and all of our abdominal muscles, including the low back muscles, will start to expand. So as we breathe in, we get this expansion and this tension throughout the pelvic core. As we exhale, we get the inverse. The pelvic floor actually contracts, the respiratory diaphragm contracts, and the core contracts. So as we breathe, we get this beautiful expansion and contraction of the pelvic core. Now we start to trickle that in with exercises. Now we're going to integrate this internal and external load and pressure system to really train the whole PCNS. Again, this is one system. It's not individual bits and pieces. So we have to train it as one system and not individual bits and pieces. So I'm going to show you 4 exercises for how to train the pelvic core, integrating breath work in as we go. Breath work. That's my first priority when I teach people or when I train people to fix their PCNS dysfunction. Breath work is going to be very specific as we go through this. So anytime I say breath work, I'm always going to imply that you're breathing in through the nose and drawing into the rib cage. We want to avoid actually drawing into the belly because that can actually perpetuate dysfunctions like diastasis and prolapse even more. Lengthening the core and giving it tension is going to be better for working with clients who have any sort of pelvic core dysfunction. So breathing in through the nose and expanding into that rib cage. Holding your breath. We do want to hold that breath just for a few seconds. And again, depending on what you're doing, you can hold it for shorter or longer amounts of time. But what that does is that teaches that abdominal cavity how to control and maintain intra-abdominal pressure. For clients who are working on fixing things like incontinence with laughing, coughing, and sneezing, those are all pretty violent changes in intra-abdominal pressure. So we want to encourage them to breathe and hold that breath. Exhaling. We're going to exhale through the mouth. And as we go through this, we don't just want to let it all out. We want to do a slow, controlled breath on the way out, kind of like you're blowing out candles. So size of a pinhole, slow, controlled breath. So again, with our breath work, anytime I mention that, we're going to breathe in through the nose, hold the breath, and slowly exhale through the mouth. The longer, the better. Why? It gives those proprioceptors and that neuromuscular system more time to process how to best work and function. Exercise number 1, we're actually going to do some reaches incorporated with our breath work here. So we're going to do a 3D overhead reach matrix here. I'm going to do a unilateral reach, but you can do a bilateral reach for your clients. I'm going to do it with no weight, but you can also add weight to this to give that core a little bit more of a load. This is a great way for sneaking in what feels like an upper body exercise if you're going to use load while knowing that you're training the pelvic core. I'm going to go for an anterior kind of overhead reach, a little bit anterior, a little bit posterior, depending on how you want to play this with your client. But go for reach, and I'm going to breathe in. This is going to give me that big lengthening of the core. It's going to give me that PCNS, or that pelvic core proprioceptive turn on. And as I exhale, I'm just going to relax there. Again, breathing in as I reach up to lengthen the core, exhaling to shorten the core. Then I'm going to go through some lateral reaches. I can go a lateral reach right out to the side. Lateral reach out to the side. Again, breathing in as I reach up. I want to provide that core with more tension. So as I reach, I get lengthening of the core tissue. As I breathe, I'm going to get an internal, bigger lengthening of the core tissue. I can also go an opposite side lateral overhead reach. Reaching overhead, reaching overhead. Again, just challenging the lateral core a little bit differently. Then I'm going to go into rotation. Take my right hand, rotate to the right, give it a nice big reach. Left hand, go in that left rotation, nice big reach, come back. I can also rotate across the body. I can take my right hand in rotation to the left. I can take my left hand in rotation to the right there. Again, you can change the angles. If you've got a weight set, we can turn this into a whole overhead press, matrices, where I'm going through all 3 planes of motion, breathing in as I go through this, and now I've disguised my pelvic core training with an upper body training system. Again, incorporating that breath work is going to be your best way to train the whole pelvic core. Second activity, I'm going to go through what we call our common lunge matrix. So I have 3 different angulations that I'm going to do, and I'm going to rotate my arms as I go through this. I'm going to use my arms as a driver to drive the pelvis into more internal and external rotation. Now, your pelvic floor is directly influenced by 2 major muscle groups, your adductors and your glutes. And those guys are most influenced by the transverse plane, or loading in rotation. So we're going to influence that whole system, adductors, glutes, pelvic floor, and the core by loading with lunges and then adding in some reaches to that. So as I do this, I'm going to go through my common lunge matrix here. I'm going to go that anterior lunge and hold. I'm going to rotate the hands to one side, rotate to the other side. Now I've taken this front hip through internal rotation and external rotation. This is a great stability exercise as well because I have to maintain that balance. So I'm challenging that hip, those adductors, to help me stabilize as I go through that. I'm also going to take it into a lateral lunge, loading laterally, rotating one way, rotating the other way, pop back home, and then taking it into my transverse plane lunge, again, rotating and rotating as I come back home. And you can add load to any of these exercises, but we're just making these body weight. If we're trying to really challenge the neuromuscular system, it's always easier to start with just breath work and no load and progress to a loaded system for more strength and stability. The third exercise that we're going to do is the sagittal plane hip drive. What I want to point out is for clients that are working to fix their diastasis, you may need to modify their start position. Diastasis is when those abdominal muscles are separated, usually postpartum. Every woman will experience diastasis who is pregnant at 35 weeks pregnancy. Now, you may experience before it, but at 35 weeks, it'll definitely happen because your abs are living on the side of your body there. So for this third one, if we have that diastasis, there's essentially a gap in the system. Taking it into a prone position is going to put pressure on that tissue right here. That's your linea alba. It's a connective tissue that runs from the sternum down to the pelvis. We don't want to put pressure on that. It's just going to perpetuate the dysfunction. They may recognize it or you may see it as pooching or doming. And so we want to elevate them into a position where it's no longer occurring. That means their core is going to actually be able to function the way that it functions without having that extra pressure pushing out against them. So we're going to just take it in that prone position. Again, sagittal plane hip drive, we're just going straight forward and back, but we're going to incorporate that breath work. Breathing in and then exhaling as we drive the hips down. Now, this is going to, again, start to get that core to function even better with that breath work because as I exhale, I'm going to get that contraction of the core. So it's going to give me more stability and more of that natural function to give me more strength as I go down into that hip drive, driving it forward. The fourth exercise that I'm gonna do is a bridge. We're gonna be supine or belly up. Now, bridges are great for clients who are working with diastasis because you don't have any pressure on that abdominal wall, and great for clients who are dealing with prolapse because based on where we're at and where gravity is, we're gonna get all of those pelvic organs falling back into place and not down into the pelvic floor. Love to teach my clients a little pelvic tilt, being able to roll the hips forward and roll the hips back. Now, a lot of times with bridges, we'll see clients try to use their low back. Best way to teach them not to do that is to actually pull the hips back towards them. So they pull the hips back towards them and roll that up. What that does is it actually gets your core tissues to pull that pelvis. So you're naturally already starting to use your core. Once I hold the pelvis here, now I'm gonna raise the hips up and trying to get into essentially that reverse plank. I can incorporate my breath work by breathing in at the bottom, holding that breath as I drive up, and exhaling as I come back down. Now you can do different variations of the bridge. You could do single leg, you can go feet against a wall, you can go little presses or reaches as you go through that drive there to stimulate different tissues or different lengthening of the abdominal tissues while holding those hips up. Another great exercise for training that posterior chain, glutes and hamstrings included in that. Why would we train our pelvic core? Well, pelvic core, like we talked about, is responsible for a lot of bodily functions, but the pelvic core is this giant portion of our body. For women especially, training our pelvic core helps us have strong hips, which helps us have strong knees. Also helps us have reduced chances of low back pain. Very common, especially after you've had kids and having to hold and carry your babies all the time. Benefits of training your pelvic core. Number one, it's gonna reduce or get rid of those embarrassing dysfunctional symptoms. Incontinence, prolapse, diastasis, pain with sex. Helps reduce or get rid of those symptoms. Number two, it's gonna better prepare your body for pregnancy, labor and delivery, and menopause. It's also gonna help you have a stronger core, which is gonna lead to a flatter core, which is gonna reduce your chances of having any sort of back pain. And last but not least, training the pelvic core helps you be better in touch with your body, or helps your clients be better in touch with your body, and recognizing that this is one system and not individual bits and pieces. Over the last 3 years, I've developed the female core conversion class at Gymnazo, FCC for short. Now, FCC is an exercise program designed to train any woman at any stage of life going through any sort of dysfunction and to help her reduce or get rid of any of these common dysfunctions. We've had so much success over the last 3 years. Hundreds of women have come in, sometimes as a last resort, trying to avoid surgery, but we have fixed multiple cases of prolapse, incontinence. Women just want to play with their kids, run down the driveway without leaking, be able to sit on the floor comfortably without tailbone pain, getting rid of sciatic nerve pain, chronic back pain, all through an integrated exercise program. We take the concepts of the PCNS, we take the science of how we know it functions biologically and physiologically. We understand the biomechanics of how this works. And we turn this into an integrated exercise program, using breathing, using lunges, using overhead presses. So women come in thinking they're getting a great workout, but at the same time, we're retraining their bodies from the inside out and helping them reduce or get rid of all these common and embarrassing dysfunctions. Now, this is just a drop in the bucket here, a little taste of what we can do with FCC. If you're interested into diving deeper into the PCNS and FCC, check out the link below. Let's leave you to my pelvic core training program, and we can get more into the ins and outs of FCC. Thanks for dropping in. Leave some comments if you got some questions, and we'll see you next time.